So thank you for tuning in. My name is Gary Galante. I'm one of the pediatric gastroenterologists at the Alberta Children's Hospital at the University of Calgary. And this talk that I'll be giving you on the flipped classroom, I promise that's the last animation of that type, is designed to look at the theory and some of the evidence behind the use of the flipped classroom. And I do focus mostly on health science education. And this is a talk that essentially I gave 2 weeks ago to the group in my section as part of our academic half. So the objectives of this presentation, which is meant to be the first of a two-part series that I'm going to be doing, will be first, again, more of the theory and the basics behind flipped classroom. So by the end of this presentation, I would expect participants to be able to explain the concept of a flipped classroom. And then, again, drawing mostly on evidence in health sciences, but which is also, I would argue, pretty widely applicable and similar to that obtained in other venues where this has been implemented, to also discuss the potential advantages and pitfalls of using a flipped classroom methodology. And then from that, as you can see here, this also ties into my idea of needing to reach higher level objectives. I would expect a participant to be able to then deduce program settings in which the flipped classroom may best succeed. And then the second part would be to plan or design a flipped classroom armed with the knowledge from part one, with also a bit of technical know-how, exploring some of the technology out there to help facilitate some of the goals around flipped class. Now, I will point out the irony in that I am teaching about the flipped classroom in a very didactic, traditional fashion, and that's what I actually did as part of my half day. But if you actually looked at the flipped classroom second part to the talk, that actually could lend itself to the in-class activities of a flipped classroom, where you're more hands-on and trying to actually engage in active learning in order to actually build a curriculum around a flipped class. With the first part, this could actually pose as the screencast, which could then actually build itself as part of a complete flipped class model. So, irony aside, it still actually could be considered a part of a flipped class. But, as we will discuss, flipping the classroom may not go over well in all settings, and of course, as we will chat about, it requires the advanced preparation on both the part of the learner and the instructor. So I'm going to start by talking a bit about what is a flipped classroom and why is it so hot right now, because it really is. So as you saw in my title, I tried to jazz the title up a bit by using slang for flipping, and that inevitably led me to search the definition on the Open Dictionary. And whereas found many definitions, the one I like the best views the term in a positive light. You can see that trick was flippin' awesome, so that classroom was flippin' awesome. That would be what I would hope that a well implemented flipped classroom would lead one to think. However, actually the most popular definition, because I can't be biased, was actually that synonymous with cursing, as popularized in Napoleon Dynamite. The truth, as we will see, is that the goal of a flipped classroom is that the educational experience is flippin' sweet rather than flippin' dumb. But of course, that's not where the term flipped classroom was derived from. So I'm going to share this anecdote because I think it's very interesting and it's not widely known, but it does actually tie into a lot of what we will learn about flipped classroom and some of the potential advantages. So J. Wesley Baker, a PhD professor in the Department of Media, did actually apparently originate both the term flipped classroom and the actual methodology, obviously the most important part. And this happened in around 1995, he claims, after This was right after the introduction of a campus computer network to Cedarville University called CedarNet, and that allowed him essentially to store his presentations on the web for easy access, so he didn't have to lug his computer around. Maybe USBs weren't that available back then, but anyways, that was what he was using it for initially. And so anyways, he had stored all his PowerPoint lectures on the CedarNet. And one day he was going through the slides and the students were copying the notes, and it occurred to him that the information from the slides, this is his quote, information from the slides is going from the screen to the notes without passing through either of our brains, end quote. And then he went on to say that he had this sort of epiphany in the class and suddenly basically blurted out to the class, well, you know what, the presentations are on the network. You can just access them online before class, and let's not waste time copying notes in class. Then after class, he realized that he essentially just gave away all of his course content. And when we think again of the traditional role of a professor or lecturer, that was, he basically gave away his expertise without necessitating students to come to class. So he had a bit of a freak out, thinking, well, what am I going to do in class for the rest of the term? And so he went back and he sketched out the model that essentially changed the role of the teacher from lecturer to the guide, and went on to implement this and eventually presented this as a conference paper. And this was titled Classroom Flip, Using Web Course Materials to Become the Guide by the Side, in about 2000. But by that time he was not alone, and actually another group had similarly in 2000 presented their implementation of what they called the inverted class model to the economics department, and they describe much of, again, what is now synonymous with a flipped classroom. They, in their description, essentially case review, they discuss how pre-class students were expected to read from texts and review podcasts or screencasts, and then in-class time was devoted to collaborative work on experiments, worksheets, answer review questions, all of which were facilitated by the instructor interaction. And I can't mention the classroom without discussing the fact that the term has been largely popularized by two high school chemistry teachers out of Colorado, Jonathan Bergman and Aaron Sams, who began flipping courses as early as 2007 and really have put a lot of work into faculty development worldwide with respect to the flipped classroom, and they published this book, Flip Your Classroom, I believe in 2012. So this model and its terms have since spread and are a growing movement at all levels of education now. While the interpretation of what a flipped classroom looks like is varied, a central theme really is rethinking the learning environment and specifically how we spend the quote-unquote face-to-face class time. So at the most basic level, and why it is so named, we should start with the description used by Bergman and Sams. That which traditionally is done in class, i.e. note-taking from lectures, is now done at home, and that which is traditionally done as homework is now completed in class. So let's take an example of what this would look like. So say I was giving a objective or was trying to teach a group about pediatric hepatitis C. So what I could do is that give a lecture on pediatric hepatitis C in a large didactic setting or in a small, it doesn't really matter, but the idea being that you don't necessarily need to have any preparation. It can be suggested, but really there's no obvious need or requirement in most settings. You know, the expectation is you come to the lecture as almost as vessels that are going to be filled with knowledge, and so there is no incentive in a lot of ways to prepare, regardless of the topic or the complexity. So you come to class, give you a talk on pediatric hepatitis C, traditionally nowadays with PowerPoint, go through many, many slides, and then you may get some assigned or suggested readings or references or cases to work through to apply this knowledge. And in a school setting, the classic thing is you go and you get your lecture, and then you go home and you do your homework assignment. And nowadays, to help you, you can go through those assigned readings, references. You may have textbooks, you may phone a friend, you may use the internet, but really that's still the basic model. So if you take a flipped classroom model, while there are variations in how this model is applied, the common themes are that the students are expected to study or assimilate the content in any form, often online, prior to class. So this is the pre-class phase, and here's an example actually of a screencast I made that's available on YouTube that you could, again, reference or create for the group to look at in advance. Then face-to-face class time is actually then redevoted to homework or active learning in class. And then afterwards, again, I mean, you could then have additional references, resources, but the homework part is now essentially completed. And so therefore that comes, the burden could potentially be alleviated from the post-class phase, which was hopefully dedicated to time prior to class that is spent in preparation. So it often incorporates educational technology, again, as a common theme. And the idea being that the in-class time is devoted to interactive higher order learning, and that I will get into that later, but essentially the preparation is supposed to be focused on more basic, lower level learning, which does not necessarily need to be necessitated in class. So I've included this slide to really illustrate two major points. The first is that flipped classroom is therefore, as we talked about, because it's often associated with educational technology, it's often used synonymously then with concepts like the blended class, but that's not quite the same, and doesn't necessarily, the term flipped classroom, as you can see, does not necessarily refer to the use of technology. So here's actually where these terms are probably maybe more appropriately or more widely used, but it's actually more associated with the content delivery of a curriculum in a course. So if you see here, the blue triangle represents increasing use of technology from top to bottom, and that also generally means more asynchronized or individualized content delivery. So the top, you see the traditional format for a course where there's essentially no online technology used. Content is delivered in writing and or orally. And that, again, probably corresponds more with a traditional model. Then you have the web facilitated model where about 1 to 30% of, or sorry, 1 to 29% of the content is delivered online. So in this case, usually web-based technology is done to facilitate what is mostly a face-to-face course. You may use a course management system, for example, or you may use classroom aids such as technology within the classroom, but it's still essentially face-to-face class. May use web pages to post syllabus and assignments, for example. So one could argue that a flipped class could still see its implementation within both a traditional web facilitated course. However, because blended and hybrid courses do tend to promote both online and face-to-face learning, that's again why it is often used, the term is often used synonymously with flipped class. So in a blended or hybrid course model, about 30 to 79% of content is delivered online, and a substantial component is delivered thus online, typically using online discussions in conjunction with face-to-face meetings. And then you have the final end, online or distance learning, where most or all of the content is delivered online. And typically there's little to no face-to-face meetings. But again, the concept of a flipped class within a course could still see itself within each of these course models. So that's the first main take-home message. The second is that, if I haven't highlighted this already, flipped classroom is distinct from online learning. Because specifically in flipped classroom, you'll see a lot of the proponents and those who work in faculty development, such as Bergman and Sams, stressing that in a flipped classroom, online learning is not a substitute for face-to-face teaching guided by the faculty. In fact, a good flipped classroom, a well-designed one, will emphasize the inclusion of meaningful, complex, and interactive learning. So what is some of the theory or research that would support the flipped classroom model, particularly in higher education? I'm going to focus on here for now. So first of all, there's some research on attention and passive learning, which is the latter of which is usually associated with the traditional didactic lecture method. So first of all, the average attention span of a medical student was studied and found to be about 15 to 20 minutes at the beginning of class. And then there's a big lull, and then it returns in more or less for the last few minutes. And medical students only remember, on average, about 20% of material presented during this time. Probably more interesting in support for the use of screencasts, which do form a large component of the pre-class component of a flipped classroom model. Now, of course, there are caveats to this. You need to have a well-constructed screencast, and again, why I'm not saying specifically this could be part of a flipped class model is that the screencast is going to be a fair bit longer, and you don't want to have a large screencast as a prerequisite for viewing prior to another additional class, because that could actually act as a deterrent for students to review. But anyways, so there are limitations, but again, a well-constructed screencast should really be considered to be as well as a didactic lecture at delivering content. So that was one of the first sort of, I think, driving forces towards the shift towards the flipped classroom. The second probably big focus has been the advancement or increased acceptance of adult learning theory, and also the preferences of millennial learners, which actually have a lot in common. And in the review that I'm referencing here, millennials were considered to be those who were born between 1982 and the present, which is not accepted by everyone, but again, useful to look at. And essentially, that now this group is the main component of adult learners in post-secondary institutions. And what's been gathered that millennials compared to Generation X, boomers, they really have a bias towards action and participatory learning as a group. They seek immediacy of knowledge, so they want to know things right now. They're comfortable in a digital world. They value social learning, and they want to construct their knowledge in groups and based on their past experiences. And they have a fierce desire for independence and innovation. And all of these things do lend themselves well, in theory, to a well-constructed flipped class model in terms of satisfying these demands and also satisfying and encouraging participation by adult learners. And really, basically over the last decade, just as important has been the fact that traditional curricula have received significant failing grades in a lot of aspects over the last 10, 20 odd years. At least it's come to light. So first, studies in the United States have suggested that a significant proportion of post-secondary students are not learning critical thinking and complex reasoning skills, which are considered fundamental to the concept of higher education and have been shown to predict future success and prosperity. And more specifically for health science education, the first major review by an independent commission since the widely publicized Flexner report from 1910 is this article, The Education of Health Professionals for the 21st Century. published in The Lancet about six or 7 years ago. And in it, many points, but most important summary is that a redesign of professional health education is necessary and timely. They failed academic health science institutions in preparing graduates for meeting professional expectations, in large part due to the rigid curricula and pedagogies that are still prevalent and have remained unchanged since the 20th century. Nowadays, we expect health professionals to be able to integrate rapidly advancing knowledge and technologies into best practice, navigating the increasingly complex healthcare systems, coordinating the care of socially diverse patients who are generally more engaged and proactive in the management of more chronic and complex conditions. And that's even before discussing the need for graduates who can help transform global health with a focus beyond just the institutions which are predominantly focused in the developed world. So for all these reasons, I would argue that this is why flipped classroom revolution is upon us, and why it's so hot right now, particularly in the health sciences. So we talked a little bit about the theory already, but I'm going to delve into that a little bit more in this next section, and then focus more on the evidence available. So looking at the theory again, we touched on it briefly before, but adult learning theory. And Malcolm Knowles is one of the pioneers of this theory, or of andragogy, and characterized several essential learning characteristics. Now, if you were an individual like Bergman or Sams, you may not agree with this being specifically characteristics of adult learners, because of course, as I mentioned, flipped class has been implemented in widespread use in elementary and junior high and high schools, thus showing that younger learners are capable of being drawn to similar thoughts and concepts in adult learning theory. But anyways, it's still useful looking at the core of the theory. And really, based on these characteristics mentioned here, which again, I said there was a lot of shared similarities with that of an adult learner and that of a millennial learner. But on the basis of this, he really advocated creating a cooperative climate of mutual trust and clarification of mutual expectations with the learner, really the guide by the side. And if you look at the flipped classroom features that would appeal to andragogy, first is the autonomy and respect, which in a andragogic model would really be an expectation to be provided to all learners. And you get that with the flipped classroom because it really does encourage self-directed learning and inquiry to increase engagement. Facilitating out-learning by giving the learners some control over the nature, the timing, and the direction of the learning. That's an important, again, aspect of adult learning theory. And with ability for preparation at your own pace, providing a variety of resources both prior to class and in class for activities, allowing for self-paced activity and personalized feedback during active learning in class would really be a strength of a flipped class in this model. It also acknowledges that everyone comes to class with a different experience, which can be utilized for success by drawing upon different learning styles and preferences. Now, adult learning theory also acknowledges that adult learners are goal-oriented, and that also can be tied into one of the other advantages of the flipped classroom is that it really should promote collaborative learning and social learning relationships. Now, motivations of learners are varied, but again, if we acknowledge a lot of adult learners and millennial learners do have motivations with social relationships, then this also may tie a little bit with social constructivist learning theory, which suggests that by fostering social learning relationships by peer interaction, that it can promote a sense of belonging, which promotes student engagement and outcomes. Construction knowledge during collaborative activities is based on the shared experiences of others, as mentioned, and it it is also a big part of experiential learning that medical students and other health science professionals receive on the job, and again ties into probably what should be promoted in the 21st century for health sciences education. There are other goals, and though a lot of these then are the need for relevancy and practical education. And so that ties in with the goals of cognitive interest, social welfare, personal advancement in the setting of health sciences education. And finding curriculum that is clinically relevant and applicable is again a strength of a flipped classroom, as opposed to a focus on basic content, which sometimes gets overemphasized in a lecture to the detriment of using active learning and higher level education, which really is at the core of clinical reasoning, clinical problem solving, which would be great to have during the classroom. And it also lends itself to a very easy idea for how to introduce active learning to health sciences education in the class, in a flipped classroom. So again, the goal of a flipped classroom, which really ties in well, is that it will put more onus on the learners to actively learn and individualize their experience to what is pertinent. So the other big theory that really supports the flipped classroom is that of active learning. And there's been a whole slew of research, not much of it actually is health science education, but obviously very much applicable. It's just been so widely studied. And this, really the best way of looking at active learning is looking at Bloom's taxonomy. And when we look at what we would consider lower level thinking and learning, we tend to focus on knowledge and comprehension, which if you think about it, if you look at these action words that really tie into these lower level lower level cognitive skills of knowledge and comprehension, those do tend to be what most people would be getting or focusing on in a traditional didactic presentation. And when you recall back to my objectives, it's still possible in a didactic presentation to focus or to try and emphasize higher level thinking, but that would require some degree of interaction built into your presentation, which is often sometimes difficult to achieve, especially when the learner comes with the expectation that they are going to be this passive vessel that is filled with knowledge. So it's very hard for them to apply their knowledge, to analyze, synthesize, and evaluate based on the knowledge that's provided. And as mentioned, it has been studied and reported advantages of active learning focusing on higher level cognitive skills are an improvement in student attitudes, i.e. them being more likely to see the benefit of preparation and engagement, interaction, and collaboration. There's also demonstrated benefits in the efficiency of learning and content retention over time, so probably even benefits on the lower level cognitive skills that sometimes are important in terms of remembering and being able to recall basic content that can be applied. And as we said, those attitudes may also then translate into better motivation and study habits, so behaviors in the long run. So I really wanted to show this study because I think it's a really interesting look at what may be driving some of the benefits in flipped classroom, and it's interesting food for thought. So in this study, they looked at a group of non-major biology students at a university in Western United States. Now they did mention that these university was composed of a highly homogeneous, highly motivated group from a highly selective university, i.e. these students were probably very bright and strong to begin with. which does become important later. But anyway, so they did a comparative quasi-experimental design. They took 2 classes taking the same course, and all of other teaching variables were kept identical, and they did pre-tests which showed group equivalence. Both followed the 5E learning cycle, and they introduced the concept of the active non-flipped classroom, which you see on the left. And so what happened in this group was they were introduced to the material during the in-class introduction. That was very much like, for the most part, like the face-to-face format you would see in a flipped class model. So it was involved group work facilitated by an instructor and or a teaching assistant. Then after class, using a course management system online, they would assign homework to submit, encouraging higher order application of knowledge. The other group was the flipped approach, where they received content attainment via technology prior, and then encouraged application of the content during class, with the assignments done in class, in groups. So interesting in that I wouldn't consider an active non-flipped class to be a traditional model, but it does go to show you that you could implement active learning without necessarily demanding preparation before class, and that's essentially what they were trying to show, is that maybe it's not the order so much that's important. And the findings were that both low-level and deep conceptual learning were equivalent on the final tests in both groups, regardless of which method they were assigned to. They had equal student satisfaction, and the contact with the instructor was thought to be more influential to the learning regardless of what was done in class. They then also compared these groups to the traditional model that had been used in the year prior, and both groups were thought to be superior in terms of learning and outcomes in that regard. So they then proposed that learning gains are more likely the result of the active learning style of instruction rather than the order in which it's implemented. I would say that I don't know if we could specifically conclude that from the study, but again, very interesting to show that an active non-flipped classroom is possible. Sorry, I'm just going to put that in there to show the differences, which were non-significant. Anyway, I would argue that this concept of order does probably matter more in delivery of content that is less familiar to a student population, and could argue that even if they were non-biology majors, if they had some basic biology knowledge that they had obtained in high school, there may be a fair bit of overlap between that and undergraduate biology classes, again, not knowing exactly what the content was that was delivered. But we have seen in medical school, for example, the concept of self-directed learning has been less successful. I'll actually touch on that in a second. When students are not as well versed in the basic content that is then expected to be applied in higher order thought processes. So some of the other advantages of flipped classroom in health sciences education can often be considered practical. So one is that curriculum development can involve multiple faculty members with different strengths and time commitments. So rather than having a lecture where one faculty member generally likes to compose it themselves because they're more familiar with it and then can present it and lead the topic, or develop a bit of an expertise based on maybe their clinical experience or academic experiences, you could distribute the responsibilities for developing a flipped classroom amongst multiple faculty members within a group. The other advantages would pertain more to the experience-based learning environment that is seen in medical student interns or clerks or residents or fellows in the medical education, and similarly for locuming, training, other health sciences trainees. But basically the common thread there would be that in these groups of students, they're often learning, in the sort of classic apprenticeship model, which is highly influenced by the variable pedagogic support received from supervising physicians and allied healthcare members and patient content that the trainees are exposed to. And also compounding that is achieving uniform access to what would be considered the formal curriculum, often delivered in academic half days, is not always easy. Shift work, geographic separation of learners, faculty availability may all drive further differences and disparities between the experiential learning that is achieved by different learners. So specifically in that context, adult learners with multiple time commitments and varied schedules may value greater flexibility provided by a flipped classroom model. And finally, there's this concept that perhaps a greater volume of material can actually be covered, especially for those more gifted advanced learners that don't need to necessarily wait for other learners to get caught up to sort of their level or understanding before moving on to other individualized self-paced activities during class. So enough about the theory. We're going to talk about some of the evidence, and I will apologize in advance because a lot of the articles that I look at are actually, when I went back and did the literature review back in 2014, 2015, and there has been actually, like I said, just with the revolution of flipped classroom and health sciences, there's probably been an explosion of literature. I have reviewed it, and there is a lot of similarities between what was found and the themes that I derive from the literature. So apologies to some of the newer articles. But anyways, when we look at the evaluation of flipped classroom and health sciences education, I refer to the Kirkpatrick's 4-level model of evaluation for learning to illustrate one concept. So if you look here, the concept being that to really see results of a change in a model or a program, one is looking at the reactions of those involved, for example, in a class, so the students, or the educators, but to look at their reactions, their attitude, like their sort of their satisfaction with what's going on. That would be one goal, but that doesn't necessarily mean you're getting good results. You want to also see learning, so that would be the next level, seeing improved learning outcomes. The third and more maybe stronger, robust evidence would be that you actually see a desired change in behavior in practice, and not just people saying that they're going to do something, but actually if you go out and see that they've achieved learning that has actually resulted in a change in their behavior that's positive, i.e. that they're incorporating best practices based on what they've learned. That would be one thing that you'd also want to achieve. Then of course, the result of that would be that you have better results, so in this case, healthcare outcomes. So all this to say that when we look at some of the health sciences education studies, I mean, it's very hard to achieve or to show that you get results of that nature. So there's been no studies actually looking at improved healthcare outcomes or results, and nothing specifically looking at behavior long-term. But we do have evidence looking predominantly at the reactions and the learning. And so that is obviously a limitation of the current literature out there. That hasn't changed over the last couple of years based on what's been published. And then the other thing would be that a lot of the studies follow what would be considered lower quality educational design, where often the groups that were compared were from different years. So a class that didn't have a flipped class, and then a year later they flip the classroom, for example, or alternatively they take two classes running simultaneously, one's flipped, one's not. So that's not a true experimental design. It would either be quasi-experimental, where they don't do random assignment, but they do a pre-test and a post-test, and they do other things to prove equivalency, or in other cases, there would be considered non-experimental design, where they, for example, take one group and they do post-test or post intervention assessment of reactions to the flipped class. So let's start with reactions, and we'll start with the good. So there have been studies that have shown a lot of favorable reactions, and I'll give you some examples to kind of demonstrate this. So the themes are shown there. So the first study I'll mention was by McLaughlin et al., and they used thematic coding to analyze open-ended comments from surveys that were completed by pharmacy students following participation in a flipped satellite classroom. And they identified three major reported strengths of the format. The positive features of the flipped classroom frequently highlighted were that it promoted student engagement with the course content, as well as with other learners and the instructor. It helped students develop critical thinking, problem solving, professional, and study skills, which, as we mentioned, is an area in which a lot of students in the traditional curricula of post-secondary institutions seem to be failing at achieving. And it created an environment that enhanced learning and increased confidence in these skills, self-directed learning, and the ability to apply course content to future practice. Very common theme was this increased confidence as well as pride in these study skills. So for instance, nursing students in the case study by Schwartz informally reported great pride and a sense of accomplishment in tackling the challenging material in the applied in-class activities. And in the study by Pierce and Fox, about 80% of pharmacy students reported confidence in their ability to address the final exam topics by the end of a flipped classroom model for a module in renal pharmacotherapy. As well, in the McLaughlin, another study in 2014, over 95% of students reported confidence in their ability to apply the knowledge or skills they had developed through the flipped classroom. And finally, interesting, this is from a study where the general reaction was actually negative, but some of the strengths identified in focus groups from pre-clerkship medical students in which the flipped classroom was introduced, that they appreciated the relaxed, non-competitive classroom atmosphere, which was created through the group discussions in this model. And they also reported that they were more comfortable asking questions of their peers or instructors in the small group setting than in a large group lecture environment. But as you might expect, it's all rosy when it comes to the reactions. In fact, a lot of students can have negative reactions. And the common theme, really, the main one I would probably say as a takeaway would be the demanding aspect of a flipped classroom. Now, nobody has studied, as far as I can tell, actually looking at the time commitment required of the students, but the students at least have this interpretation or impression that for the most part in these studies the flipped classroom has demanded more of them than a traditional model. Whether that's the perception because they're doing a lot of the work up front, I'm not sure. Technically the idea would be that it should be time neutral because the time they would spend preparing would be offset by the reduced time afterwards that needs to be devoted to a review of the content. And again, hopefully you get better learning efficiency in the flipped classroom model, but again, nobody's really looked at that. But the perception by students for the most part has been that it's more demanding than less demanding. And that potential to demand more time from the adult students, especially when the expectations of additional preparation are not offset, like I had suggested, by the reduced time demands in other areas, this can lead to decreased satisfaction with the course or the instructor in some studies, possibly if the students feel that their busy schedules are not respected. So, for example, despite the positive reactions in the case study of Schwartz, PhD nursing students had described the learning experience as intense and demanding. In another study by Missildine et al. In 2013, nursing students in the flipped classroom had higher examination scores, but they were less satisfied with its methods, and they argued that it increased workload. Meanwhile, they doubted the benefits of his interactive learning approaches. As I mentioned, they actually ended up having higher scores in the long run. But they may not have known at the time that they'd done this survey, and perhaps were dissatisfied with the amount of time that was spent. Similarly, in a graduate flipped classroom, students remained indifferent about the course format despite having improved scores, and some retained unfavorable views about it while simultaneously reporting that it had facilitated their learning. And I can't remember if it was this article or the other one where they'd actually looked at individual responses, and those who had better scores, there were a fair number that actually felt that it had not facilitated better learning, in spite of the fact, like I said, that they were some of the students that did better with the format. And then another example would be that when comparing final course evaluation responses between students who completed a basic pharmaceuticals class, this is again a study by the McLaughlin group, that despite improved examination performance in the flipped classroom group, there were no differences noted in the overall course ratings or in the evaluation of the quality and relevance of the learning materials and resources and methods implemented between the groups. So again, key finding: demanding nature can be off-putting for students, even if they don't know that they're doing better with it. And then I really think it's useful looking at this case study as, again, sort of a negative example of reactions, because it also probably resulted in a lot of ways. I mean, nobody studied learning outcomes, but the suggestion was that it had a negative impact on the students and the faculty involved. So basically, in a pre-clerkship medical study, they had implemented flipped classroom sort of in a widespread nature. This is a study by White in 2014, and essentially it was more of a qualitative study where they did focus group interviews because of dwindling attendance and disruptive student classroom behaviors that were reported after this change or this introduction of the flipped classroom curriculum. And they did content analysis from these subsequent interviews, and it revealed that some findings that actually were discrepant with what the curriculum developers had suspected. They had suspected that the students were perhaps developmentally not ready for this learning style, or even perhaps didn't have as much basic knowledge in these areas and thus couldn't apply them as well. But that's actually not what some of the themes were. So one theme was this idea of concept of readiness and preparedness, both from the perception of the students and the faculty of one another and of themselves. So faculty felt unprepared in a lot of ways, and students felt that the quality was thought to be too inconsistent, and there was too much time spent waiting between activities. So that goes back to that concept of one of the strengths of flipped classroom is that it can provide individualized self-paced content. So ideally you have students and groups learning at different rates and then interacting with one another as needed and as part of the activities, but with the goal being that it doesn't slow anybody down or it doesn't leave people with these big lulls between activities where they're just sitting and waiting and they feel like their time is not being respected. The other interesting thing noted, again, probably more with the logistics, is that medical students were allowed to sit with their own friends instead of being in assigned groups, and that had a particularly negative impact, both because they were more likely or easily able to engage in social interaction with their friends, and the fact that they said they were less pressured to prepare for class because they were less concerned of being chastised or embarrassed by their friends as opposed to other students with whom they weren't as familiar with. And then there's this interesting other concept of matching assessment content to the pedagogy. So they said that the classroom activities addressed skills and knowledge that were not thought to be relevant for subsequent exams. And the wonder there would be if the exams stress lower order cognitive skills like knowledge and comprehension rather than the higher order cognitive skills, which were hopefully being encouraged or stimulated through flipped classes, then perhaps the flipped classroom methodology was on the right track, but it wasn't being rewarded, the time or effort that students were being put into it. And knowing that they're adult learners and hopefully outcome-oriented, a big outcome that medical students need is to be able to pass and do well in their studies and be able to move on to the next module. So really, the study does raise the several potential barriers to the successful implementation of the flipped classroom, which include the attitudes of the students towards active and adult learning principles, as well as the consistency in curriculum delivery and the faculty development that is required, and the need to match the formal exam content with that delivered in class. So what about learning outcomes? Well, I'll say that learning outcomes following the flipped classroom model have primarily been assessed by examination of course content at the end of the courses. And they have either supported a positive effect of the new format, no effect, and I have not seen any that have shown a negative effect of the flipped class. So it probably is good or makes no difference. And that may in part be related to how it's implemented. That's my theory, at least. I have no evidence to support it, but I will, well, I should say I have a little bit of evidence based on my preliminary results, which I'll present in a moment. But that may not necessarily be the case. It's one thought, though. And again, maybe it will tie into some of the effects of active learning. So, one article by Miss Aldine et al., I already alluded to it. This is the one where the nursing students actually overall had higher examination scores, but were less satisfied with the methods of flipped class. But as mentioned, the final exam scores were higher in the group that was exposed to the flipped classroom when compared to a traditional lecture format group, as well as a traditional lecture format group with access to electronic lecture capture as an adjunct, which is basically a screencast when they could view one that they could view prior to or after the lecture. So this is interesting because it's another way of looking at the order in which material is presented. Technically, they could have reviewed the material in that electronic capture group prior to class, but the order was of non-significant importance, but it didn't have the active learning component. So perhaps another piece of evidence supporting the utility of active learning in class, but because the flipped classroom group did the best compared to both the traditional group and the traditional lecture format group. And this was the same course that was taught in 3 consecutive semesters. Here you see a nursing education systematic review, and of which that Miss Aldine article was one of them. And you can see here that they couldn't compare the different studies, but these were some of the studies where they looked at examination scores, of which some of them are there. We can see that in the final exam, there was only improvement in that study I mentioned, whereas in 2 studies there was no significant difference, but in one of them there was an increase in interval scores. So again, not a uniform improvement noted, but either improvement or no improvement. That's a similar trend in other groups. So there were 3 studies comparing the performance of pharmacology students on final examination content, comparing that taught by the flipped classroom content in 1 year and to the traditional classroom format the year prior. 2 of these were by McLaughlin in 2013 and 2014, and then one was a study by Pearson Fox in 2012, which I don't reference here. But 2 of these demonstrated significantly higher exam performance by students in the flipped classroom group, with one of the McLaughlin studies, the one in 2013, showing no statistically significant difference between smaller groups of satellite students exposed to the flipped classroom. So again, either improvement or not. There was a study by Toon et al. In 2013 that simultaneously compared flipped classroom format in a modular course delivering comparable physiology content to that of a single module of a different course that was taught in a traditional classroom to, this was to first-year graduate students. And after taking identical exams, students in a flipped course, their scores were significantly higher than their peers in the traditional course. So not a strict format where they compared groups. They looked at the module was the same, and the content was the same, just taught in different formats. So you can see here that, again, some of the limitations being that either quasi-experimental or non-experimental, in this case that it was a post-test only assessment. So what are some other potential positive outcomes? Well, essentially what it comes down to is that there were some positive comments that suggest that maybe students exposed to the flipped classroom do value some of its elements, which again may translate to behaviors, if you will, that would or strategies that would serve the students better for the future, whether it be future studies or future practice. So one thing would be improved class preparation and participation, or seeing the increasing value in these aspects of the flipped classroom. So if they increasingly value these methods following the experience, maybe this would mean that we translate to other courses or motivate students to do that for other courses. So in the study examining the similarly redesigned satellite flipped classroom in pharmacy students, they compared pre-course and post-course surveys, and they showed an increase in student support for learning content prior to class, for using class time for more applied learning, and there was increased belief that learning the key content prior to coming to class would significantly enhance their in-class learning. Interestingly, in another study by McLaughlin, the one in 2014, the student preference for the format over a traditional lecture format increased from 27 to 85% by the end of the course, so positive reaction. But when they compare the students enrolled in the traditional classroom from the previous year, those exposed to the flipped classroom were more likely to think that the instructor was engaging. So that was maybe another positive reaction as well. And the thought is perhaps they're more engaging because they're facilitating active learning. I should also mention that graduate students' comments following a modified flip course suggest that some of the favorite aspects of the format were that incorporated lectures that were accessible for them to review, and it promoted increased pre-class preparation, which was thought, again, to enhance their ability to be prepared for class and ask better questions. So again, showing some buy-in. What are some reported limitations and or concerns from a practical perspective? Well, I mentioned the one positive benefit earlier, that faculty, maybe with varying experiences, can all contribute to developing the flipped class. I would argue that, I mean, there needs to be a significant investment in faculty development to be motivated to put in that cost, right? Potentially, if you make a nice flipped class, it makes it easier to facilitate it for future, and you don't necessarily have to review an hour's worth of lecture content every time you give a talk, for example. Actually, in part, I developed this talk because of a flipped class that I had made as part of my study, which we're continuing on in our section, and I was using this as a means of helping our faculty appreciate the benefits of the flipped class, and also be prepared to facilitate it. So that's my faculty development, but you have to have motivated individuals who are willing to put the effort in and time in, both to develop the faculty so they feel comfortable doing the facilitating of the active learning exercises in class. You also have to make very good pre-recorded content, which we'll get into in the second part of the talk for a later date. But also you have to be able to deal with the nuisances of the technological distractions and again, navigating things, making screencasts as easy as possible, or making other ways of getting the content, and then also developing those active exercises, which do take a fair bit of work because, again, they're promoting higher order thinking, so it's a bit more challenging than copying content that you just want to deliver to students so that they can just comprehend it rather than to apply it. So I'm going to end by talking about some unpublished work that I'm working on writing up, but this is a study that I did as part of my master's in medical education. And what I basically wanted to know was in third-year medical students during pediatric clerkship, so again during their 6-week course in pediatrics where they rotate through clinical, it's mostly clinical experience, they rotate through various areas. What impact will a flipped classroom during the academic half day, which is part of their formal curriculum that everyone gets on a weekly basis, what will the impact be on student satisfaction with the class, so again reactions, preparation for or attendance in class, learning outcomes, which I assessed with clinical problem solving, of related content through the means of a test, which we specifically formulated the questions with content experts and medical education experts to assess higher level thinking amongst all the objectives that we had defined. And an additional thing was to look at cognitive load during class activities. So cognitive load essentially is a way of looking at the mental effort that students are putting in during class, and it's something that it's actually been shown that they're very capable of self-reporting, which makes it easy to study. And not to go into all of that literature in great detail, but there is some evidence that suggests that you need to basically hit a sweet spot. You don't want the cognitive load to be too high where they're overloaded, but you also don't want them to be not putting any mental effort into class, which again is probably a way of supporting, another sort of means of supporting the need for active learning in class. Anyway, so I looked at all of these things. I compared I compared medical students rotating through, and each rotation was assigned to a different format. But this was all within two graduating medical school classes at the University of Calgary, Cumming School of Medicine. And so it just ended up being 55 students who were in the traditional classroom group, 61 were in the flipped classroom group. They all had similar demographics, their MCAT scores, years of post-secondary, postgraduate studies, their age, their gender, and their clinical experiences in the topics that I was assessing, which were chronic diarrhea, which was obviously under gastroenterology, and acute abdominal pain, which I took to be as experience in surgery of any kind, specifically general surgery. And again, in all those aspects, there was no difference between the groups. Their pretest scores were also very similar on a 12-question multiple choice test, which I had designed again to test varying levels of Bloom's taxonomy and the objectives. And this was done at week 1 during enrollment. So this was the first academic half day, which was done on a weekly basis, where they also completed the demographics. So then in the traditional group, they had access to the presentation handouts, which included the PowerPoint slides and my notes that accompanied them. And I said that they could, I suggested that they read them or review an article of which I provided a list. And so then on the week 3, the academic half day, they got instructor-led presentation, always done by me in a PowerPoint fashion. I tried to make it as interactive as I could, but it was not an active, wasn't promoting a lot of active learning strategies. I did ask questions, and I led them through some clinical cases to highlight examples. but again, it was mostly they sat in and listened and were allowed to ask questions, of course. But again, what you would traditionally see with a lecture. And I gave 1 hour on pediatric chronic diarrhea and 1 hour on pediatric acute abdominal pain. In the flipped classroom group, so I tried to keep it low key in terms of technology, but I did do the pre-recorded content in screencast form, and they were given access to two 20-minute videos, actually 4 10-minute, but anyways, two in each top, two 20-minute total on each topic. And I strongly recommend that they review these in advance of class, and I also provide them with a list of readings as well if they preferred that, which were the exact same as those in the traditional group. On the week 3 academic half day, they got instructor facilitated activities. So this consisted of background knowledge probe questions at the beginning. So they were asked some multiple choice questions to test some like basic content that I had provided in the screencasts, and we were also allowed to use that to ask some questions and to illustrate some concepts. And they also had an opportunity to ask questions about the screencast material. And then for the rest of the time, they did what I would probably call a modified write, pair, share format for active learning, where they grouped in 3 to 5 students, and they worked through case-based learning on these topics, trying to address the objectives. So they would write down their answers, then they would discuss with their group, and then come to a consensus answer, and then they would share their results with the group at the end, with other members, with other groups, I should say. So again, I would call it low fidelity. We actually had some students in other parts of the province occasionally, and in those cases, I tried to team them up. So I told them in advance that they should get their phone numbers, and they talked it out over the phone in the write, pair, share format. And they also via video conference they reviewed with they summarized their results to the group. So the other thing you'll notice is that we tried to make it quote unquote time neutral. So the 20 minutes of videos were subtracted from the course time, the class time, so that 60 minutes was spent. Now, I did get some comments that it took longer than 20 minutes to review the videos because they paused them intermittently to catch up, etc., or to rewatch some topics. But again, the idea was that it was time neutral. And in fact, if you think about the time the traditional group was supposed to spend in preparation or reviewing articles, one could argue there's probably similar expectations. So anyways, at the week 3 half day, at the end of the presentation, I asked them to complete a survey where they discussed were asked to comment on their reactions towards the experience and the preparation. And then I also asked them to rate their cognitive load by their mental effort that was needed. And then at the very end, the last week of the clerkship, 3 weeks after the half day, I gave them a post-test with 12 questions addressing parallel objectives and similar level of difficulty on the whole. And again, not published, but found some interesting results. So the flipped classroom group was a bit more likely to review this screencasts versus the slides in the traditional class group. They were actually probably, I haven't done the full analysis yet, but they were also probably a bit more likely to review the recommended articles, which is interesting. The flipped classroom group, that is. When it came to the reactions, they were either more likely or equally likely to comment that learning key content prior to coming to class significantly enhanced the learning experience, and that they had to prepare for class in order to be successful. They were either as likely or more likely to agree that the time and effort was well spent in class, and that active engagement was consistently encouraged by the teacher, myself, and that the in-class discussion of concepts significantly enhanced the learning. And they were as likely or more likely to have an enthusiastic impression of the assigned class format, and they were more likely to give a better overall rating of the flipped classroom as compared to the traditional. And then also interestingly, I still haven't completed the analysis, but the average cognitive load reported was 6.4 in the traditional class group and 5.2 in the flipped class. 6.4 in the flipped versus 5.2 in the traditional class, which suggests that perhaps, again, this might explain a mechanism as to why learning efficiency and outcomes may be better in the flipped classroom group. And it may also suggest a way for educators to quickly and efficiently judge whether or not the benefits of active learning are being achieved with the simple self-reported rating. So that concludes this first part of the talk. In summary, the flipped classroom has the potential to improve preparation and participation, so preparation for the class and participation in class. And it may be either or both, but I would say that based on the few studies that we have, it's more likely the active learning that is beneficial, with the idea then being that if you can deliver the basic content prior to class, which they can learn with equal efficiency as they would have otherwise learned in class, then you get a bigger bang for your buck in class if you introduce active learning. So there's kind of a bit of both to that. That would be really the potential that you would get from the flipped classroom. It also thus has the overall potential of improving learning outcomes and satisfying the needs of the adult learners. As mentioned, is it the active learning versus preparation? Not sure. And will it satisfy the needs of the learners without being too demanding? That's the other sort of thing we have to balance and be respectful of and mindful of. And then I guess also being mindful and respectful of the faculty development that's needed up front, and the time commitment and investment that would be needed by all parties involved. And that really probably presents the biggest limitation and barrier to implementation, particularly in the health sciences education, I think. And I'll leave you with a quote by Malcolm Knowles, which basically says, "You don't just throw people into the strange waters of self-directed learning and hope that they can swim." And I would argue that the same would be said of the flipped classroom methodology, which in a lot of ways demands self-directed learning, but also active learning being a key component of it, and the preparation. But it has to be all well done and well orchestrated. And that's what the second part of the talk will be about. So thank you for listening.